Hours after docking at Port Canaveral on Monday, we saw small groups of masked passengers loaded into separate vehicles. The extra precautions happening after the CDC says a norovirus outbreak sickened 102 guests on board the Caribbean Princess, along with 13 crew members.
We just thought it was food poisoning, and then the next morning we heard that there was an outbreak of the norovirus throughout the ship.
David Hansen caught the bug early on the 13-day trip out of Fort Lauderdale. The cruise line later began to isolate those who became ill.
Basically 24 hours of gastrointestinal experiences, and after that he started feeling better.
With norovirus being highly contagious, Princess Cruises says workers disinfected the ship and added extra sanitizing throughout the voyage.
Did you see any extra cleaning measures on board?
Oh yeah, absolutely. They were very adamant about hand washing and taking care of your rooms.
But they were having the staff serve the food at the buffet, so that was probably a big game changer in that respect.
The ship undergoing a comprehensive cleaning as it's welcoming thousands more passengers on Monday.
It wouldn't stop me from cruising. Just make sure you keep yourself hands washed and take care of yourself, bring hand sanitizer, you should be fine.
In the United States, 18 people have made it back home and are under medical monitoring at healthcare facilities. One travel vlogger is documenting his journey inside of a quarantine unit in Nebraska.
Good morning, everyone. It is my second day here at the National Quarantine Unit in Omaha, Nebraska, and I just wanted to give you a little tour of my room. Here's my thermometer for temperature checks during the day. I have a stationary bike for exercise.
There's no indication that Jake Rosemarin has tested positive for hantavirus. He said in his social post he's, quote, okay and feeling well. He's one of the lucky ones. One doctor who cared for people on the ship has tested positive. He's asymptomatic but is being held in the biocontainment unit.
They're in full hazmat gear or proper protective gear, and I just see a pair of eyes.
Two other people, a couple, are being held in a biocontainment unit at Atlanta's Emory University Hospital. According to the World Health Organization, there are 11 Andes hantavirus cases linked to the MV Hondius cruise ship, and the WHO warns that more cases could emerge in the coming weeks.
But I don't expect to see hundreds or thousands of more cases.
Experts say this variant of hantavirus does not spread easily, and the risk to the general public is low.
So among those 18 Americans who've just been repatriated, 16 are at the University of Nebraska Medical Center in Omaha, and 2 are at Emory University Hospital in Atlanta. And at last check, one of those 2 in Atlanta is symptomatic. Now, health officials say that the incubation period of this Andes strain of the hantavirus, which is the time between exposure and showing symptoms, is quite long, up to 42 days. Now, despite World Health Organization guidance, the United States is not requiring people considered high-risk contacts to quarantine and be monitored for that full 42 days. Of course, you'll recall President Trump pulled the U.S. out of the WHO. Many health officials, though, urging these Americans to still follow this guidance, but say there's no need to panic.
Let me be crystal clear. The risk of hantavirus to the general public remains very, very low. The Andes variant of this virus does not spread easily, and it requires prolonged close contact with someone who is already symptomatic.
Just one of the ways officials say it's much different than COVID-19. So now that all passengers are off that MV Hondius cruise ship, the crew is sailing it back to the Netherlands. It'll take about 5 days, where the ship will be disinfected.
Even though health officials are stressing this is not the next COVID, the concerns are high. How dangerous is hantavirus compared to COVID-19, just in terms of hospitalization and death rates?
Yeah, so the best way to really compare them is kind of saying this. So COVID is a lot more widespread and contagious. That was the problem there, was how easily it was able to spread. But hantavirus can be a lot deadlier for the people who do get seriously sick. So the CDC says hantavirus pulmonary syndrome is fatal in nearly 4 in 10 people who were infected in this cruise-linked cluster, who says the case fatality ratio, they're saying it's currently 38%, so that's 3 deaths among 8 reported cases. COVID can also be pretty severe, especially for older adults, people with underlying conditions, but the CDC says risk varies widely by age and health status, but it's not a straight apples to apples comparison. But what we can say is it seems like hantavirus at this point is a lot more deadly.
Right, and it seems like, you know, Ever since this unfolded, we've been rapidly hearing about exposure. Explain to us, elaborate a little bit more on why, if you suspect exposure, it's critical that, you know, you get early medical attention.
Yeah, sure. And from my understanding and what I read on the World Health Organization's website today, their documentation of this is they're saying that because patients can really deteriorate very fast, it's a very fast virus. So the CDC says that early supportive care is really critical even before the diagnosis is confirmed, because suspected hantavirus pulmonary syndrome can progress quickly, and delayed care lowers your chance of survival. So it's important to act fast. WHO also says that symptoms can start with fever, chills, muscle aches, dizziness, stomach issues even, but then it can suddenly turn into a respiratory distress and low blood pressure. So very interesting to look into all of this, and we're going to have to wait and see how this continues to progress.
We're getting flashbacks of those early days of the pandemic, it feels like, and it can be a little unsettling, but here, let's break down the facts. Hantavirus is mostly spread through contact with infected rodents, including their urine, droppings, or saliva. And this strain, the Andes strain linked to this cruise ship outbreak, it's been shown to spread between people through very close, prolonged contact. Meanwhile, 17 Americans exposed to the virus have now arrived in the U.S. and are being monitored at the quarantine unit at the University of Nebraska Medical Center, the country's only federally funded quarantine center, and also in Atlanta at Emory University Hospital. One passenger has tested positive. One person in Atlanta is symptomatic but has not tested positive. Health officials say the overall risk to the public, it still remains low.
How do the symptoms compare to COVID and the flu?
Yeah. Well, early symptoms of hantavirus, it can really mirror symptoms of COVID or the flu, and that means fever, fatigue, muscle aches, headaches, and sometimes nausea or coughing. In those more severe cases, hantavirus can quickly progress to serious breathing problems as fluid builds up in the lungs. There's some big differences between COVID and hantavirus in the rate of transmission, its novelty or newness, and incubation period. In COVID-19, it was a new novel illness. We all remember when it shut down the world in 2020. Hantavirus isn't new. COVID, it spreads very easily through airborne particles and can move rapidly through communities. Hantavirus is harder to catch. With COVID, someone can spread the virus by breathing, talking, or coughing. With hantavirus, this strain would likely take sustained close contact to spread from person to person. Now, the incubation period, that means how long it takes from exposure to symptoms. That is also different than for COVID-19. COVID incubates within 2 to 14 days. For hantavirus, it's a staggering 1 to 8 weeks.
Caution and wisdom is what should prevail here. It's a rare viral family that is carried by feces of rodents or in their urine or saliva, and it's really confined to a few areas of the world. So it is not very common to come across it, and it can cause, obviously, a severe hantavirus pulmonary syndrome. But again, to your point, it is very rare, and the exposure to it, in America, we've had fewer than 1,000 cases in the last 30 years. So it is rare.
That's how rare it is. That's almost non-existent, if you ask me. 1,000 in the past 30 years. And this is what's dominating headlines now and sort of bringing, you know, this fear, sort of fear-mongering, I feel like sometimes. But what has been brought, in this case particularly, is the Andes strain. So what, I hope I'm pronouncing it right, Andes strain. What should folks understand about that strain and how rare it is when you talk about person-to-person spread?
Well, and that's a great point. Ironically, I was just in the Andes a few weeks ago, and was I worried about it? Of course not. You just don't go to areas that are dirty and low hygiene. And the Andes strain, the concern is it can spread in rare cases from human to human. However, the cases we have in America is a different strain. Some people will remember the outbreak in the 1990s in the Four Corners region of the United States. The virus itself was originally discovered in Korea in the 1970s, so there are substrains, and some of them are more aggressive than others. The Andes one can be dangerous to those who get infected with it, but to your point, you know, we think about thousands of children per day around the world die from TB or malaria, and yet when the news finds something novel, they like to hype it, but at the end of the day, you know, data requires calm.
What symptoms should someone take seriously if they feel like they've had some possible exposure without assuming every flu-like illness is hantavirus?
Yeah, good point. Because only about 1 in maybe 10 million cases would be hantavirus. Flu is obviously more common, but muscle fatigue, aches, which progress more to some nausea, GI, upset, and then from there, filling of the lungs with fluid. And that's when the case becomes more serious, and that's when one would want to get medical attention quickly in order to abate those symptoms.
And you said the treatment is what? What's the course of treatment here?
Well, the course of treatment is generally supportive. Respiratory care, are there some of the drugs that we use during COVID that can prevent replication of the virus? Absolutely. So there are antivirals. The individuals who get very good medical care generally have good outcomes. The unfortunate deaths that occurred on the cruise ship, the MS Hantavirus, those were elderly individuals, perhaps with risk factors that haven't been revealed yet. So the majority of people will do fine. It does have, a fairly high mortality rate if not treated. But again, to your point, most viruses are common colds or flu or, even some of the lingering COVID variants out there. But most people, when they get a flu or a cold, don't need to worry.
So if it doesn't spread person to person, if it's not likely for it to spread person to person, like you said, it's rare, then are you getting it from food you're eating because of rat droppings that could possibly potentially be contaminated or something?
Ooh, you bring up a great point. It's more dust that's kicked up in an environment that's enclosed or a low hygiene environment. If there's an infestation of rats or mice, and a couple of other rodents in the Andes can carry it as well. So it's basically don't be in a dirty, dusty, enclosed environment where there's been a rodent infestation.
Is it ingested? So it's literally you're breathing it in?
You're literally breathing it in,
okay.
Correct.
Okay, all right. So very quickly, what's the most practical takeaway for viewers who want to be informed and not alarmed?
The most practical takeaway is don't worry. Look, people die from lightning strikes and sharks, and we don't restructure our lives for that. You don't need to restructure your life for a rare outbreak that's being managed well by public health right now.
I think the greatest takeaway for me is 1,000 cases in 30 years here in the U.S. And for more information, visit imahealth.org. Dr. Ryan Cole, pleasure talking with you this morning. Thanks for joining us.
Thank you, Jan.